Welcome and good evening, everyone. Thank you for joining us tonight for the talk on Take Back Control When Anxiety, Stress, and Depression Strike. Tonight's presentation is brought to you by Finlandia Pharmacy and Natural Health Center. They're always looking for better ways to serve in health and innovation. In addition, Biomed is a professional affiliate for Finlandia. We're really excited to be bringing this first ever public lecture to North America. We're joined by two of the world's most renowned experts in energy medicine, and combined they have over 35 years of experience in Europe that brings a new understanding to the concepts of sickness and health, with a revolutionary healing modality called Rubimed, which will be discussed tonight. This provides a complementary medicine approach to address emotional issues and their related physical and emotional conditions. The topic tonight is not just about mental health. It's also about emotional health and physical health, essentially whole body health and well-being. Acknowledging body-mind medicine is becoming more accepted and more mainstream. There's a growing body of science and research that proves this. It's called psychoneuroimmunology, and it has direct connections between the body-mind connection and shows that it's not always just in our head and it's not always just physical either, that we are an entire being and very connected in our whole. You being here tonight proves that having an open mind is definitely going to be leading to a healthier lifestyle. And finally, what I'd like to do is turn the presentation over to Dr. Banis.
Yeah.
Thank you.
Yeah, I thank you for the invitation. I was asked, together with my colleague Dr.Holschuh, to speak here in front of an audience, and usually this is not my main profession as a speaker. I'm a medical doctor, and usually I speak to one patient and not to so many. And usually people come to me with complaints, and I work normally as a normal physician, as you can find here also around Broadway, wherever you go. I did laboratory, and every normal doctor does, but if you work with people, especially chronic ill people, you will find that many of them have complaints which you cannot explain. And also not explain, but also are not treatable by allopathic medicine. You can give strong remedies, how you say it, push the symptoms down with antidepressants, with tranquilizers, but this is often not the good solution. So you want to have something which helps people for a long time and hopefully makes them recover, heal. It's a big word, heal. I've never healed somebody. I think Mother Nature is the thing healing, and we can just remove problems which prevent people from heal. And to find such issues which prevent you from heal is very difficult. Usually if you look in your medicine books, you would say medicine doctors are so bright, so educated, they know so much, but I can assure you we know nearly nothing. It is just, how you say, like a fairy tale to believe that medical doctors know the body, but if you know in one cell you have around thousands of chemical processes every second. So if you would look just in one cell of your body, what is happening, and you have billions of them. So nobody can even imagine what is going on in the body. And if you would look at medical science, let's say 100 years ago, you would say they were mostly stupid compared to what we know nowadays. And if you would look in the future, you would say people are almost stupid also today, but I think the normal doctors, they don't confess that. Maybe if you put a lot of alcohol in them and they are almost close to retirement, maybe some of them will confess, but usually if you go to a normal doctor, he will assure you he knows your problems and he can handle that. But I can tell you from my own experience that is not often not so, how you say, well working, and also not going to the ground of many issues. And my own wish was always to go more to the root of problems. And I did a lot of natural healing modalities, and I invented a method I want to show you today. It's a little bit misleading because we deal with anxieties, stress and depression, but this is not the only thing we are working with. So we can say we deal with a lot of modalities. My colleague Dr.Holschuh, she's also a medical doctor, she will later on talk about that too. And I think you should, I can begin and shortly give you a short introduction in the method. So first I want to mention that the normal medicine usually thinks of neurotransmitter problems. This is the assumption of the normal medicine. It is a little bit funny because there's no real proof for that. It is just an assumption, so that they speak about serotonin deficiencies and so on, but this is not really proven. It's just an assumption. But medicine believes that there is something like a, neurotransmitter disbalance, and they put remedies inside of you if you are depressed to bring up your neurotransmitters. This is often not really good working. You can say that a lot of diseases, let's say schizophrenia, depression, also anxieties, get better by the modern allopathic drugs, but they are often not really healed. That is what I have seen. And then you have psychotherapy. Many people are not willing to have a psychotherapy. It is a long, often very long treatment. Or many people are also not willing to open emotionally, have the intellectual abilities. For instance, if you have little children with problems, they cannot speak about that, so it's also not for everybody. Then you have reasons to get depressed, maybe if you have a tumor, infections. So it is often advisable, if you have such problems for a longer time, to go to a normal medical doctor, make a check, and see if you have something like that. Then we have these unknown causes for depression and anxiety. I want to speak about these things today. There are hidden metabolic dysfunctions, emotional conflicts, and geopathic stress, electrosmog. I want to speak about that in the next slides. So conventional medicine, conventional psychology, usually all my patients have that. So it is very rare of them come to me and don't have that. So I'm the medical doctor for the extra, complementary. I give some extra treatment. So I'm, for instance, for those people who are resistant to the therapy, or who want to have a deeper access to their problem. The typical experiences, if you have people with such problems, they say daily life is a burden, they have anxieties, worries, But this is not always the case. You find, for instance, often in men, people who have depressions and make a self-treatment with alcohol. So, for instance, a lot of men who are heavy drinkers are depressed persons who make a self-treatment with alcohol, or people who are anxious subconsciously. Also other drug abuses. Then many of the patients I treat have a long history of medical journeys, so I'm often one of the latest to consult. They have used a lot of methods, acupuncture, Reiki, so they say it didn't work. And the method I used along, I was lucky to meet also Reinhard Voll. He was the inventor of the electroacupuncture to Voll. Maybe you have heard about that. You measure the skin resistance at certain acupuncture points, and then he found relationships to certain diseases. And later on I worked closely with Helmut Schimmel, a medical doctor in southern Germany, who also worked on the acupuncture points. Here you can see him testing on an acupuncture point with his device. And these doctors were the ones which gave me first ideas, teach me methods, and I tried to make it more simple and also go deeper to the roots of problems, and I invented a method called Psychosomatic Energetics about 15 years ago, and I use applied kinesiology now. It's called an arm length test. I just pull the arms of the patient. I afterwards show you a little video. I have a little device which stresses the subtle energy field to see if the charge of the energy field is good. In most patients it's not good, and then I have little vials with homeopathic and other remedies to see the reasons why the energy is not good. So the method is now used by thousands of practitioners, and the reason why Birgit and I am here, we teach here courses for health practitioners to make the method here also available, because we believe that it is something which is a good approach for many creatures, I would say, from animals to human beings, from children to old people. So we see a lot of good things happening if this energy load is good and you don't have energy blocks. Here you can see how the method is done. So the patient is connected here to the device. We press certain points. Here you see a reaction of the arm length. Here the arms are equal. We measure different layers of the subtle energy. For instance, here the emotional layers. And we see if the thumbs are equal, and if a patient is stressed, we see they are unequal. So here you see what we do, the arm length test. It's a kinesiologic approach. The problem with all these methods like kinesiologic, it can be, how we say, disturbed by mental influence. So the problem is to make it reliable. You have to stay in a meditative and relaxed mood and stay neutral as the tester, so that you are not biased by your own thoughts, expectations, and so on. So it is a certain way to do that, and I can assure you that good testers get the same results. Even if for instance, if a patient comes from a good practitioner, I look at the results and I can confirm them. So it is something which really works. Here's the machine. I don't want to go too much into detail. We all have different layers of our subtle energy. This is also for people who know yoga. This is very common known. We have a low vibrating vital energy, emotional, mental, causal, and these layers have a certain charge, like a battery, and if you have enough of this energy, you feel good. So you can say the more energy you have, the better it is. The normal energy here is 100% vital, emotional, mental, and let's say 70 causal. If somebody is, for instance, chronically tired, chronic fatigue, we call that, he has low vital and emotional readings, and after being treated, the values go up. So it is a little bit what we can do is something like the blood pressure. We can measure the subtle energy charge, and if it goes up, we can say the patient is getting better, and usually then he feels better. So when the patient has bad values, we can say, okay, this is not good. What is the reason for that? So we have to find problems which cause these low readings, and we use for that a process which we call medicament test. So if you put remedies close to a person, put it in his energy field, and they relate to the person, then you get something like a different arm length test, or the muscle gets weak if you press on the arm. So you can say by doing this, you can find out what is the cause, the root of the problem. Here, for instance, you can see how the medicament test is done. So different ampoules with homeopathic remedies are put in the machine, and I look at the arms and see if the patient is responding. Here you have a clear response. The arms were different. And so by doing this, we can find the reasons for chronic diseases. Here's an overview about the significant causes we have found. You can say emotional issues, emotional conflicts, you can find in almost all patients who don't feel good. In patients who feel good, they usually don't come to us. No? But if I have maybe somebody who says, just check me, I feel totally okay, and I check them, usually they have no emotional conflicts. And they have also not the other problems. So you can clearly distinguish healthy from sick people. And can say people who are ill or feel bad usually have emotional issues, I would say in almost 100%. Almost everybody has that. And you don't have to be, how you say, emotionally stressed. It is something which comes maybe from the childhood or wherever it comes from, and then these problems show up and rob you energy. I will explain that later. Then the second big issue is geopathic stress. I know that this is not very well known in the United States and Canada. Geopathic stress means that you sleep with your bed on an area where the electromagnetic field is not healthy. So usually if you sleep on such a spot, you can get sick on long term. After 5 years, 10 years or so. So if you sleep in such a bed just for some nights, no problem, but for longer time, it can cause you really problems. And the problem is you get used to that. So maybe you say, I just feel sometimes tired, my sleep quality is not so good, or whatever, or I have rheumatic problems, I have muscle tensions or whatever. But usually you don't relate that to your sleeping spot. And for instance, if you sleep on water, like here these water homes in Vancouver, you are more protected against geopathic stress. So sleeping on water houses is very good, because then you are shielded, you have no geopathic stress. Then another big issue are the intestinal problems from bad bacteria in the bowel. Maybe you have heard the death in German. There's a saying, death comes from the bowel. We say the root of sickness is in the intestine, and this is known since since the old days, and we can confirm that, so that we can say bacteria inside of you can cause a lot of problems by being toxic and so on. Then bile duct dysfunction. Maybe you have heard remedies must be bitter. So bitter is something which improves your gallbladder function. This is also a main problem. And then foci means chronic infections, chronic sinusitis, root channel teeth which are not properly healed, and such things can also make a lot of problems. And then heavy metals, in my opinion, are only a minor cause. They are also important. I think other issues which can affect the health, like these, how we say this, when you have chimneys and you have this smog pollution coming out, this we cannot measure. This is also something which should be mentioned, or smoking and so on, but I think this is self-explaining, so I'm more for finding these issues. And we have done studies, because you can say we have only fantasies, we are maybe not, you don't trust us, but we have done studies, and we have seen in people also, for instance, with severe diseases, attention deficiency disorders, severe chronic pain conditions and such things, we have seen 80.5% results after a treatment of 8 months. So you can say it's and if you treat longer, 12 to 18 months, we have even 85% success rate. What we have seen is that children respond better. So if you treat children, they have a 90% success rate. And we have also done studies, for instance, Birgit has done studies, maybe she will talk about that later. We have, after removing the emotional issues and the conflicts, we see long-lasting results. So people stay good for many, many years now. Then, for instance, we have also renowned specialists. For instance, here one of the chief psychiatric, she's the head of the biggest, one of the biggest psychiatric hospitals in Switzerland, where the I would say, local state of Graubünden. And she is now working also for 4 years with PSE in her clinic with this modality, and is very confident, happy with that. She sees very good results, for instance, in manic, bipolar, schizophrenia, depressions, and so on. So very good results with that. And she combines that with normal allopathic medicine. Then I want to go shortly explain you emotional conflicts. So this is just general explanation from the American Psychosomatic Society. What we have found out is that almost all patients have these emotional trauma. So everybody of us has these trauma, and usually you don't have to have something which is life-threatening or which is really that you have maybe had something like child abuse or whatever. We are all very, how do you say, very sensitive and vulnerable organisms, souls. So it seems that we all have emotional trauma inside of us, and mostly we are not aware of them. They are just subconscious. So if you do something like maybe take an LSD trip, then warp, your subconsciousness comes out and all these things show up. But usually you are not aware of these things. Or maybe in deep hypnosis, deep relaxation states, you get aware of that. No? So they are like sleeping demons, like tigers under your curtain, or which don't affect you. Here you see an image which shows that the conflict has also 4 layers. So it is something like we have 4 layers as a human being, and the conflict has also 4 layers. So it is something, if you would speak in modern terms, you can say the layers are something like our software, and the conflict is something like a hard disk, or is part of our software not accessible. So that you can say it is a part of our energy is stolen. And the tricky thing is, besides the energy robbing aspect, is that the conflict is something like a hidden influential thing for your behavior. So you are subconsciously driven, let's say, by such things to behave in a way which is not good for you or for others, for instance. So you have, or you get bad mood, bad behaviors, bad mood, and such things. And here you can see a short overview. You have a feeling of frustration, of getting angry. You cannot express that. You swallow it down. You have a conflict of fury inside of you. And often what we see is that these people afterwards get depressed. So they have their inner aggression stored inside of them, couldn't express it, and then afterwards you turn to be like a brave child, very, how do you say, non-aggressive, just the opposite. So you can say, often you can say emotional conflicts you find are the opposite of how you pretend to be or how you are. So if you are, maybe you have a James Bond type man, very strong, they often have a lot of anxieties inside of them. So you can say, or people who are very, I would say, friendly, they often have suppressed aggressions inside of them. So often, for instance, people with depressions, this is well known in psychosomatic, have aggressions. Here's an overview about all the conflicts we have found. I don't want to go into detail with that. You can say, just to mention a few, anxieties often sit in the heart. The heart is the center of our energy, and depression, or often feelings with frustration, often sit, for instance, here in the upper part of the body, in the belly. Then when we check patients, we usually find a conflict. Here you have a relationship between the symptoms and the treatment of conflicts. Usually when you treat a conflict, the symptoms get better. So it is a process of 4 months as average to heal a conflict. We have certain homeopathic complexes which we use. For instance, for fury, we have a complex which contains remedies like lycopodium, tarantula. Maybe you heard of this spider which makes you crazy and such things. So we have these emotional issues are represented by homeopathic remedies, and we give these to patients, and then the conflicts melt away by resonance. So it takes usually 4 months to heal one conflict, And then when one conflict is healed, in about 90% of all cases, another conflict shows up. Why this happens, we don't know. This is just something like we have found that in thousands of patients. And you have, when the second conflict shows up, you get an aggravation of your complaints. You feel not so good again. Then the second conflict has to be treated, and after the treatment of the third, you usually have a stable, good condition. So you can say 3 conflicts is usually recommendable to treat them. Then I want to speak shortly about geopathic stress. I think if you want to know more about that, we have books which you can read. It is a whole, longer thing. I should speak about that maybe some hours to explain it in detail. You can say it has something to do with the electromagnetic field, which is not harmonic at these places, but until now there is no evidence in natural science terms what geopathic stress is. So until now you can only say organisms are affected by local influences. Let's say animals, for instance, you have animals who like geopathic zones, cats for instance, lions, tigers, all these things, they like geopathic zones. There are also other animals who don't like them, for instance cows, horses, then human beings, of course. And here you can say trees are also affected by geopathic stress. They have the problem that they have no feet, so they cannot walk away. So when you are a tree, you have to grow, and when you stand on a geopathic stress, you build something here like these knots. So when you are exposed to geopathic stress for a long time, let's say 3 years, 4 years, 5 years, you can really get sick. And in many chronic patients, we have seen geopathic stress. It is almost unknown because as a therapist, you don't earn much money by recommending that. And as a, let's say, pharmaceutical company, it's also not good in money terms. And so usually it is a rather unknown issue, unfortunately. But I think it's for the health of the public, it's, I would say, even as important as a heavy smoking. I would say geopathic stress, a severe geopathic stress is even worse than smoking, let's say 50, 60 cigarettes a day. This is a very strong impact on your health. And we have worked about many decades, myself, Birgit, and many other medical doctors, naturopaths with many good doses. The problem is to find reliable doses because many of them are not reliable, but some of them are really good. And here, for instance, you have a lady with breast cancer, and you see that the things are here crossing in her breast zone. Here's another patient, for instance, with thyroid cancer. You can clearly see in his throat region the crossing of these grids. No? And here, for instance, you have 2 trees, a healthy tree, and here you have one on a geopathic zone. I have here an enlarged photo to show it better. Here you see this tree on the geopathic zone, and if you would walk here through Vancouver, let's say Stanley Park, and you would be aware of that, you would be amazed how many trees are affected by such things. And if you would build a house on this zone, and you are forced by the architects to sleep there, you will build something like knots or sleeplessness and other symptoms, so you will also be affected in many ways. Starting from bedwetting in children, nightmares, behavioral disorders, in other people, let's say rheumatic problems, chronic pain, sleeplessness, chronic fatigue, even rheumatic problems. We have seen dowsers who told us multiple sclerosis, even maybe cancer has a relationship to that. And when we have found these problems, let's say emotional issues, I mentioned already these emotional conflicts and the geopathic stress, we recommend the patient to move his bed to a good zone. Then you can say that often many people have an improvement of their health and that a lot of issues disappear. And at that point I want to give the word over to Birgit, my colleague. She's a medical doctor and will introduce herself and show us some cases.
I welcome you too, and I'm very glad to be here to give you some practical impressions of a method with which I'm working since 15 years, and which is exciting for me all days, and I find it's an ingenious method. I'm a medical doctor, I'm a general practitioner. I come from Germany, of the southwest, near the French border, and I'm a general practitioner since 30 years. And in my clinic, I could treat a lot of patients with traditional medicine, but there was also a lot of patients that I couldn't help. And therefore, they made diagnostics, they made lab parameters, but they had a lot of pain, but nobody found any results. Therefore, I occupied in the following years the alternative medicine, the holistic medicine, and had an education in homeopathy, in kinesiology, in acupuncture, in several energetical test proceedings. And in 1999, I met Dr.Banis, and it was very interesting for me at that time to hear about emotional background of diseases. Because at that time, there was no appreciation for emotional backgrounds. And we treat in this method not only physical symptoms, we treat also emotional problems. And in my practice, I saw more and more those patients, and also patients that I want to present you now, because that's the topic of the evening: anxieties, depressions, burnout. And in those topics we made a lot of good experiences with psychosomatic energetics. Anxiety disorders, we find patients who don't know what is the reasons for their fears. Patients can be afraid, can be frightened, and it's all worse because they don't know any cause. And in those cases we speak about panic disorder. But there are also patients with anxieties who have a concrete fear, who perhaps have a fear of flying, who have a fear to go in an elevator, or sometimes to meet the boss is a fear for them. Those disorders are called phobic disorders. And what we find where patients with anxieties are that they have fear of crowds, that's an avoidance of social situations, and here this fear of flying, fear of heights. It can go on a tower, and in a panic disorder, we don't know reason for their fears. And patients with generous anxiety syndromes, they have a lot of worry. With additional symptoms of anxiety, as not only emotional problems, also physical problems. Perhaps a palpitation, a rapid pulse. Patients have pain. They have pain in the neck, they have pain in the back, they don't know what is on the tail, and sometimes there's headaches, sometimes there's an oppression, a thoracic oppression, or perhaps also pain in the belly. Sometimes you find tremors, hands can tremble, perhaps the whole body can tremble, and sometimes such patients have a wobbling voice. Patients can feel dizzy, weak, and woozy. And they can be restless, nervous, and and feel very tense. What we find also are these sleep disturbances, and patients are often very heavy, weary. Anxiety disorders are very important because in Germany we found 8.5% of patients who suffer from these disorders, and you see in Canada it's 12%, in the United States 20%. And I think it's necessary that we find solutions for those patients. What can we do? In the traditional medicine, we can give them perhaps tranquilizers as benzodiazepine, or also the new sorts of antidepressants as citalopram, paroxetine, and so on. But those medication has only a suppressed symptomatic effect. If patients discontinue these medications, all problems they feel another time. Also possible is in anxieties a behavioral therapy. That means that patients learn there how to cope with fearful situations. That can help. That is sometimes successful, but not in all cases. And we propose a solution-oriented therapy, and that's a treatment with this Rubimid therapy, with the medication that Dr.Banis has just presented. And in this treatment, there's a big rule of life energy. In the initial treatment, we can give first, if patients suffer a lot of anxieties, the Rubimid remedy Anxivita. And often anxieties are accompanied of problems of the autonomic nervous system, as arrhythmia, outbreaks of sweat, or diarrhea. And then you can give also Simvita. It's also a Rubimid remedy. But those medication is good for the beginning, but you have in each case to resolve the subconscious conflicts. And now I want to present you a typical case of my practice. And it was a young woman, 19 years. He had anxieties a long time, about 10 years, and she had just taken antidepressants, tranquilizers, had made a psychotherapy, but nothing had helped. She also has often nausea and a vomiting reflex, and therefore she dropped out of school. When she came in my practice, she said, I can't go to school. My favorite desire is to become a nursery nurse, but therefore I must go in a special school, and that's not possible. And her mother came with her, and she was very sorrowful and desperate about the future of her daughter. In the first session, those were the readings. You have seen the Reba device, what we can measure with this device, and this was very facilitating for patients, because if you have a young girl like Lisa, nobody can explain her why she has those fears, why she don't feel good, why she cannot go to school. But now we can measure it, and we above all, it's vital in the emotional energy who is decreased. You see here, Lisa has a vital energy of a half that has to be, and an emotional resilience only of a quarter. That means she has no stimulus, she has no impulse to go to school. And the problem behind this was a panic conflict in the heart chakra. It's our chakra of confidence, and when we have no trust, no confidence, we have fears. In this case, it was panic. 4 months later, as here again, you see that the vital energy and also the emotional energy has increased, and at that time she feels better and can decide to go to school as daycare worker. She feels more stable, and also the anxieties and also the sleep disturbance had been met. But we want to achieve nearby 100% that patient would be stable. And you see, the next conflict had to be treated, and this problem is in the first chakra, that's in our pelvic, and in our pelvic it's the center of rootedness, of groundedness. And such a problem, you can say, not being centered in oneself means that it's like to pull the rug out from under, and therefore she isn't very centered, and she doesn't live in the here and now. It's like a feeling to bob up between heaven and earth. And we had to resolve also this problem. And 11 months later, you see the readings have increased nearby 100%, and this corresponds to her own feeling. Now, she told me that she enjoys learning at school, the fears have disappeared, and her mother says now she's my Lisa again. I think that's all. I thank you for your interest in psychosomatic energetics.
Yeah, I'm the final, how you say, the final curtain man. So I want to come to the conclusion. And as you have seen from the cases Birgit has shown, usually 2 or 3 energy blocks have to be removed. So it is a treatment which is not a quick fix. It takes time. We have tried to make it faster. We have therapists who use, let's say, EMDR. Maybe you know this eye movement thing, or tapping, where you
emotional freedom.
And emotional freedom techniques and so on. But usually they make it a little bit better in the beginning, but the whole process usually is not accelerated. So it seems for me the soul needs his time. So we have something like a pace, like the speed limit here on the highway. So you cannot drive faster. Your soul needs something to recover. And what we do is something also the people get rid of their emotional issues, but they have to change their emotions, their attitudes. So this is something which comes, how you say, subconsciously and slowly. And we see often very good improvements in patients. We are no miracle healers. We have also people which we cannot help. If diseases are too far advanced, we come too late. Sorry to say that. That's a thing we have to admit. But we can say in many cases, early stages of diseases, we often see very good results. Especially in very good results in children, animals, because they are more energetically open. So you can say the older you get, the more rigid the whole energy gets. And the typical benefits are written down here. So you can say what we see is that people get more able to do their daily work. They have a better self-esteem. They know better what they really want. They can handle stress better. We have seen, for instance, people who had electrosmog, or you have treated a lot of patients with food intolerances, even food allergies, hay fever and such things. So when you have a better energy, your immune system improves. So you are more stable. And you have then an ability also to handle the stress of, let's say, these hay fever things, electrosmog, stress at the workplace, difficult relationships at the job and whatever. No? So you are more able to cope with your daily work. And we have seen people, for instance, who are 100 years old or very, very strong, very healthy. They often have a very good immune energy system and have not much conflicts. So we can say, and also no geopathic stress. So we can say if you are full of life force and of free life force, optimistic and so on, you are healthy. So this is something which is very valuable. And I think especially if you look at children are our future. And we have seen, for instance, children, many of them, they have energy blocks and they are energetically not good. then they cannot concentrate in school. They need Ritalin, you say that, Ritalin, this, and such things. And we have helped a lot of these children, for instance. Also, we see a lot of symptoms disappear, also physical symptoms which you would not usually relate to emotional stuff, like, let's say, arteric, venous ulcera, or diminished flow of arteries and such things, which usually are regarded as a totally mechanical problem, but we have seen very good results also with our treatment. Testimonials of colleagues. So we have a lot of very nice words, compliments, testimonials of our colleagues. One of the nicest thing I've heard from one colleague was she had a whole bunch of diagnostic devices in her clinic, and she said, if I have to go to a remote island and I'm allowed only to take one device with me, I will take this PSE device with me. So for those practitioners who are used to work with this machine and this method, they see it as a totally new approach, and very helpful also for us as medical doctors, but also for patients, I think. Yeah, then I have also here a testimonial of a patient. He can better understand himself. I would say we are all mostly a miracle for ourselves. So self-awareness is one of the most difficult things. So you can say the person who knows you the worst is yourself. So to know yourself, you need your other human beings to reflect who you are, but also to have a better energy. Then you get more open and you can get better into contact with yourself. So it is also a process, you can say, of, how we say, self-awareness. Yeah, then I want to thank you for your interest and hope you got some nice ideas. Yeah, thank you very much for your interest, and